Of course, refinement is not a new thing, and if I might just read from the House of Representatives Hansard from the 3rd of September 1991, when Bob Hawke was talking about refinement on their Medicare co-payment proposal. Mr Hawke says, the fact is that we have addressed in the budget a very important issue in regard to Medicare, that's the Medicare co-payment introduction. It is one which understandably has raised concerns and issues in the minds of not only members of my party but also groups in the community who are entitled to have a real interest in this matter. We're going to provide the opportunity for members of the caucus who, over the years of this government, have had a very substantial and constructive input into the decisions of the government. We're going to provide them with the opportunity to make what I'm sure will be positive and constructive contributions. So refinement is not a new feature. But Secretary, I just want to go to the issue. A co-payment proposition is not a new idea. It was introduced, not only as an idea, but it was a budget measure, and then it was legislated for in 1991 under the Hawke government. So I'm curious to know what conversations the Department of Health might have had in the period 2008 to 2013 in regards to a GP co-payment.
I think this is very similar to the question that your colleague next to you asked earlier, and I said we'll have to take that on notice.
Why?
Well, one, I'm unclear as to whether we actually can answer the specifics of that question, and two, I don't think we can answer it right now in any event, even if we can.
Right. Let me be more specific. Have you had any approaches from the Department of Finance or the Department of Treasury over the past 6 years in regards to a GP co-payment? Because
my earlier answer applies, Senator.
That you don't. What was your earlier answer?
One, I'm not sure whether we are actually permitted to answer that question.
Right.
And we'll have to take some advice. And secondly, we don't have that information available to us. We get asked for all sorts of things all of the time, and quite frankly, going back to the dates you've indicated, I don't think any of us can remember. We will have to check.
2008 to 2013.
Yep.
Last year.
Correct.
Secretary.
And it is fair to say, Senator, we would deal with probably amounting to hundreds of options in budget processes and more broadly over the course of that period.
I suspect that not all budget proposal ideas are the same in terms of the level of interest that they might attract internally or indeed politically. How long would it take to get the advice about whether or not you could reveal to this committee about whether or not Treasury and or Finance had approached Department of Health about GP co-payments in the period 2008 to 2013?
I don't know the answer to that. We'll make inquiries in an expeditious way in terms of the propriety of the question. I mean, you'll understand that we don't wish to create a precedent by answering a question, and then so the question of whether we can answer, we'll check and we'll come back to you as soon as we've had some advice. We'll have to go to the elders and betters and central departments. But in terms of what we've been asked in relation to the past, I don't know how long it would take us to find that out.
Just to be clear, in order to find out whether or not you can actually advise this committee about whether or not you can answer that question, yep, you'll need to go to Treasury and Finance.
No, Prime Minister and Cabinet.
You'll need to go to Prime Minister and Cabinet.
We will.
My next question goes to the issue of the Department of Prime Minister and Cabinet. I'm just curious to know whether Mr Watt has at any time raised with you the proposal of a GP co-payment.
Dr Watt?
Dr Watt, the Secretary of the Department of Prime Minister and Cabinet.
As in, was he party to discussions in relation to this matter?
Has he come to you with a proposal in regards to a GP co-payment?
Has he personally come forward with that?
Has he, in his capacity as the Secretary of the Department of Prime Minister and Cabinet, spoken to you in your capacity as the Secretary of the Department of Health about a GP co-payment proposal? In
a broad context, he has raised the issue in a discussion amongst... I mean, it's very hard to answer that question, Senator. Bilaterally approached, no.
Just explain that, bilaterally approached, no,
well,
as
your
opposed to unilaterally.
Has he approached me one-on-one in relation to that matter? No.
Have you been in discussions with other people and Dr Watt in regards to a GP co-payment?
Senator, it is no secret that the budget decision-making process involves a range of ministers as members of the Expenditure Review Committee and their relevant officials and their relevant advisors. It's fair to say that the Prime Minister and the head of his department are both party to Expenditure Review Committee discussions and decisions, it is fair to say Dr Watt was party to those discussions.
So has a GP co-payment been an issue under consideration by the Expenditure Review Committee in the period 2008 to 2013?
And my earlier answer applies, Senator. I can only talk about the process we've just been through. We'll have to go back and look in relation to the other issue.
Secretary, with all due respect, I don't think that is a defensible response. An issue of a GP co-payment, if it had been under consideration in the period 2008 to 2013, I'm very confident that you would recall that.
Well, your confidence is very welcome, Senator, but I can't answer the question until I've taken broader advice.
And how long will that take to get the broader advice?
We will go to the Department of Prime Minister and Cabinet and we will find out.
Or put another way, you can't rule out that a GP co-payment was discussed in the period 2008 to 2013.
Senator, you can't. Senator,
That's
I am
Thank you,
saying to you, I will take advice on whether the question can be answered. You cannot impute from that I'm either ruling anything in or ruling anything out. That is not reasonable.
Because the issue of sustainability around health funding and the Medicare is not a new issue. It's not a new issue to this government. It's not a new issue to previous governments. So I'm keen to explore, what nature of proposals might have been discussed as a way of sort of introducing or maintaining some stability into the Commonwealth's health funding budgets. And I'm keen to understand whether a GP co-payment had been an issue of consideration. I'm keen to understand whether Dr Watt raised the proposal with you in his capacity as Secretary of the Department of Prime Minister and Cabinet.
And I'll take advice, Senator.
And you'll be able to get back to us in an expeditious manner, I think was your word.
If the answer comes back expeditiously, we will seek it expeditiously, but if I don't get it expeditiously, I will not be able to come back to you. But if we get it expeditiously, we will certainly come back and advise.
That would be great. That would be great.
Sorry, Chair, when you do take that on notice, Secretary, would it be possible, if in fact you've taken the advice, you can answer the question, and in fact it was proposed or discussed during 2008 to 2013, you also able to come back with what figure was suggested as a proposed GP visit co-payment during that period?
We're getting into hypotheticals, Senator. Let's find out whether we can provide any advice practically first, and then we'll see what it is we have.
Okay, one question, please.